Welcome back to MTP number 33. Today I'd like to talk about penile rehabilitation. And I'm not talking about penile rehabilitation prior to surgery, which we will address one time, but I want to talk about your job as the patient and what you need to do in order to rehabilitate yourself and get back to sex as quickly as possible. I'm sure many of you have had a hip or a knee, and you may or may not have seen your surgeon after surgery because you go to a rehabilitation facility. If we had a rehabilitation facility, it would probably be called a brothel. So you have a job that you have to do. And I'm going to be a little skewed on that job because I'm going to apply it to my approach, because I don't do a penis-scrotal approach. I do an infrapubic approach, which is an approach from above. And this I do know well, that how we rehabilitate our patients. I can tell you for the first day or two, because a man's pelvis is such a sturdy structure, you want to stay fairly sedentary because things move around and you get a little bit more bleeding or oozing in areas where you might not. So for the first couple of days, you don't have any other job than just to relax. You can drive your car the next day, you can walk upstairs the next day, but truly the more sedentary you are, the better. So our patients, day one, meaning the day after surgery, they're taught to reach up, grab their scrotum, reach above the pump, grind away at any material that might be above that pump, and pull down on the pump. And the reason you do that is so that pump does not migrate up. That's one thing that we happen to see a lot, and it doesn't matter which approach you use in patients if they're not active in pulling down the pump. During this process of pulling down the pump, depending upon what type of pump you have, you'll be able to start finding those release valves, because those release valves are essential. Remember those erections you had when you were younger that lasted an hour and they hurt like hell? And you can imagine if you inadvertently pump up your implant and that kind of pain that you would have, especially in the beginning, and you can't get it down. It's called priapismic pain. So our patients, day one, are reaching up, trying to find those deflate mechanisms, pulling down, and keeping that pump where I placed it. You can't do this with the penis-scrotal approach because you have an incision there. That would be for the first week, one of your only jobs. The second week, the job that I have patients do is they pretend to deflate. They actually go in there, and your legs can actually compress that pump a couple of times, and you put a little bit of fluid into the implant, and you'll feel the implant detumescing or getting soft in your hands. So the second week, you're totally devoted to trying to deflate your penile implant. By the end of the second week, patients show up, they get their staples out because we have a little tiny incision above the penis. And when the staples come out, I get to have the pleasure of being the first one to pump up your penis. At that time, if there's any gentle modeling, meaning making sure it's perfectly straight, we can do that. This can be a little painful. Imagine you're a pitcher, right? You blow out your shoulder, you get the Tommy John procedure, and are you going to pitch a 90-mile-an-hour ball the next week? No, you're not. So that first round of cycling may be a little bit uncomfortable. But if you show me that you're able to put down your penis on that 2-week visit to my office, then you get to start pumping it up yourself. My recommendation is you do like 5 pumps, put it down, maybe 10 pumps, and then put it down. And then if by the end of that 3rd week you're able to fully inflate and fully deflate, you're ready to go back to the real world of sex. And so that rehabilitative process is fairly simple. It's fairly cookie cutter. If you follow it, if you, the patient, that's your job. We don't have a rehabilitation facility with a bunch of good-looking girls or good-looking guys, depending upon your predilection. You have to do it yourself. If you do it yourself, you're going to have a great outcome. And if you look at the statistics, it's at least 98% patient satisfaction rate. So this rehabilitation process is essential to having a great outcome with the penile implant. And that's the end of MTP 33, and I'll see you for MTP number 34 next week. Take care. Have a good one.